Hi everybody, it's Leanne here from Polite Poocher Sydney with Dr. Tennille for our regular Friday at 5. And today we're going to be talking to Dr. Tennille about some emergency first aid procedures we can put in place for different situations that we encounter with our pets. So, Dr. Tennille, we come across a dog or our dog who's bleeding profusely from a cut in the foot. What would be the first thing we do?
So the first thing you do is try to stop the bleeding. So a good thing to do would be, if you had a bit of bandaging or dressing at home, is I've got a little prop here. So you might want to get something relatively clean and apply pressure to the area. And if you could keep your hand there while you go to the vet if it was really quite bleeding a lot, or you could, if you had just a temporary dressing that you could put on there to try to apply some pressure to the area to stop the bleeding. If it was really bad and pumping out, you could do like a homemade tourniquet with a belt or some rubber band or something. Obviously that can only stay on there temporarily while you get your pet to the vet, but you want to stop the bleeding, protect the area, and if it was really dirty, depending on the level of bleeding, if you could, you would try to flush to get the general contamination out of the wound. So you might want to, if it was a really big contaminated wound, you could even use a hose to get it off if it was a really large area, or if it was just a small area, just syringing some saline or something over the area just to get the contamination out. But if you're not far from the vet, then you stopping the bleeding should be enough, and leave the rest to the vet to sort out for you.
And how quickly would you recommend that the owner get the dog to the vet?
If there's any type of full thickness wound in the skin, then they should go to the vet immediately. You shouldn't, if it's after hours, you should really get to a 24-hour vet if possible, because of infection risks. And we have a bit of a saying in the veterinary field, the golden period, which is generally, if with a laceration or a wound, depending on what caused it, there's a bit of a 6-hour period where you can close the wound without having to, where it will close quite nicely. If you leave it longer than that, then the wound will have to be debrided and freshened up and everything before it can be sutured together.
So in other words, the sooner the better.
The sooner the better, definitely.
Absolutely. So we come home, we find that our dog has been in a fight with our second dog at home, and one dog appears to have wounds. What should we do?
Go to the vet.
And how quickly should we go to the vet?
The thing with dog bites is they mightn't look like much at all from the outside. Like sometimes it might just look like a single little puncture with a bit of blood. And you're like, oh, that's not very bad. But the thing with dog bites is they're always worse than they look. Dogs' teeth are designed to crush and tear the underlying tissues, so they might not look like there's much on the outside, but there'll be a lot of trauma underneath, and they almost often need surgery. And the sooner that you do it, and the sooner you get infection risk under control, the much smaller the procedure will be.
Excellent. And what if we find a cat that has got bites on it?
Sure, so if it's from a cat bite, they're kind of different. Cat teeth are more, they puncture and cause massive infection, as opposed to dog teeth, which crush and traumatize the soft tissues. So for cats, if the wound hasn't punctured all the way through the skin, then you could do a superficial clean and monitor. But if you can see it's gone all the way through the skin, then you need to go to the vet, and you'll save lots of money if you go to the vet straight away, because you'll often just be able to treat that medically with some antibiotics rather than having to have a surgery, because if it goes all the way through the skin, cat teeth are so dirty and full of bacteria that they'll get an abscess every time, and that will need surgery.
Oh my goodness. So Tennille, I come home this afternoon, I find one of my 3 dogs has got a swollen eye that's closed. What should I do?
With eyes, never muck around. So with dogs and cats, if you come home and they have their eye closed for any reason, or there's a large discharge, then look, it's almost an emergency. Like, I wouldn't wait at all really for that sort of thing. I mean, if it seems like it's opening and then it's normally and then it's closing a bit, I guess you can watch it for a little bit. But if it's closed and it's not opening and they're really just sort of squinting all the time, you need to go straight to the vet. That eyes are one of the most painful sort of conditions you can get. So yeah, it's something that should be an emergency.
Perfect. So I, in the past, had a dog who suffered from seizures. So what, for example, would you recommend for a client who observes their dog having their very first seizure ever?
Sure. So the most important thing to do, I mean, often this is something you won't have time to get your animal to the vet. So you want to basically make the environment as calm and quiet as possible. So turn off all the lights, turn off any music, don't shout or yell. So you want a nice, quiet, dark environment. Don't have lots of people crowding around. Just one known sort of owner to the pet can comfort and calm the animal down whilst all other stimulus is turned off. Make sure the pet is safe, so there's nothing sort of that it's near that can fall on it, or it's not near some stairs, or if you need to put some soft blankets around if it's paddling, then make sure they're nice and safe. And the other thing that's important is if it's a known diabetic, is you want to get something sugary onto its gums, like some honey, because certainly a diabetic pet who's on insulin can seizure if they are overdosed on the insulin.
Okay, so that's fantastic. Now,
then you should transport your pet to the vet as soon as you can. I mean, if your pet doesn't stop seizuring, because most seizures seem like they last forever, but most of them are under a minute. But if it continues to seizure past a minute or two, then you should be safely trying to transport your pet to the vet so they can get something to stop the seizuring.
Excellent. So I walk out into the backyard and I see a dog collapsed.
Take your pet to the vet. Yeah, I think collapse is something that, I mean, if your dog sort of falls and, just stumbles or something and gets straight up, back up again, I mean, you can just monitor it. But if your dog properly collapses and can't get up within a few minutes, then, there are some heart conditions and things that, you would want your vet to have a check of your pet, even if it, after a few minutes, gets up and seems okay. The other thing is to check the colour of the gums. One of the causes of collapse would be some internal bleeding or hemorrhaging from tumours, or if their heart stops pumping blood properly. So have a look at the gum colour of your pet if they collapse, and if it's pale or white, emergency. Get your pet to the vet straight away.
Straight to the vet. And just one last one.
When in doubt, straight to the vet.
And I can't recommend that enough because it's the only thing that saved King's life. A dog, you notice that your dog has suddenly developed quite a bad discharge from their ear, for example.
Yeah.
Would you watch and monitor, or would you recommend?
No, they need to go to the vet. I guess this is one of the things that's probably not like I need to get there within 5 minutes, but if there's a large discharge coming from your pet's ear, it'll be really uncomfortable and painful. So, you want to go to the vet pretty quickly just to make them comfortable. So having an ear discharge, especially like a pussy discharge or something, is going to be quite painful for them. So you want to get them to the vet so they can get the right treatment to make it comfortable.
That's excellent. Thanks so much, Tennille. I appreciate all the input, and we'll see you next Friday.
See you next Friday.